Which of the following is the most common cause of cerebral morbidity in patients undergoing adult cardiac surgery with cardiopulmonary bypass, CPB? A. Hypoperfusion. B. Embolic events. C. Hemorrhagic stroke. D. Neurotoxic effects of anesthetic agents. Answer: B. Embolic events. Explanation: embolic events, often resulting from thrombus formation or debris dislodged during cardiopulmonary bypass, CPB, are the most common cause of cerebral morbidity in adult cardiac surgery. These emboli can block cerebral arteries, leading to ischemic strokes. Hypoperfusion and hemorrhagic stroke are also important causes, but embolism remains the leading contributor. Which of the following is most strongly associated with postoperative cognitive dysfunction, POCD, after cardiac surgery? A. Duration of cardiopulmonary bypass. B. Age of the patient. C. Preoperative hypertension. D. Use of heparin during CPB. Answer: B. Age of the patient. Explanation: age is a major risk factor for postoperative cognitive dysfunction, POCD, with older patients being at higher risk. The elderly often have pre-existing cerebral vascular changes, and the combination of age, surgery, and CPB can exacerbate cognitive decline. Although the duration of CPB, hypertension, and heparin use may contribute, age is the strongest determinant. Which of the following strategies is most effective in reducing the incidence of cerebral morbidity during adult cardiac surgery involving CPB? A. Maintaining a high systemic blood pressure. B. Using a lower temperature during CPB. C. Minimizing the duration of CPB. D. Administering prophylactic anticoagulants. Answer: C. Minimizing the duration of CPB. Explanation: minimizing the duration of cardiopulmonary bypass, CPB, has been shown to reduce cerebral morbidity by decreasing the time the brain is exposed to low perfusion states and embolic events. Maintaining an adequate blood pressure and using a lower temperature during CPB, mild hypothermia, can help protect the brain. What is role of near-infrared spectroscopy, NIRS, during cardiac surgery with CPB in preventing cerebral morbidity? A. Monitoring cerebral oxygenation. B. Detecting cerebral emboli. C. Measuring brain temperature. D. Identifying brain activity. Answer: A. Monitoring cerebral oxygenation. Explanation: near-infrared spectroscopy, NIRS, is used to monitor cerebral oxygenation during cardiac surgery with CPB. By measuring the levels of oxygen in the brain, it helps to detect early signs of cerebral hypoxia, allowing for adjustments in perfusion or oxygenation before damage occurs. NIRS does not detect emboli or measure brain temperature or activity. Which of following factors is associated with a higher risk of ischemic stroke following cardiac surgery with CPB? A. Hypotension during CPB. B. Increased hematocrit levels. C. Use of low-dose aspirin. D. Prior history of transient ischemic attacks, TIA. Answer: D. Prior history of transient ischemic attacks, TIA. Explanation: a prior history of transient ischemic attacks is a strong predictor of ischemic stroke following cardiac surgery with CPB. These patients have underlying cerebral vascular disease, making them more susceptible to embolic events or hypoperfusion during surgery. Hypotension during CPB and increased hematocrit may also contribute but are less strongly predictive than a history of TIA. Which of following complications is most likely to result from poor perfusion during early stages of cardiopulmonary bypass in cardiac surgery? A. Hemorrhagic stroke. B. Global ischemia. C. Cognitive dysfunction. D. Seizures. Answer: C. Cognitive dysfunction. Explanation: global ischemia, often resulting from poor cerebral perfusion during the early stages of cardiopulmonary bypass, CPB, is a well-established risk factor for cognitive dysfunction, including postoperative cognitive dysfunction, POCD. While hemorrhagic stroke and seizures are more likely to result from other factors, inadequate cerebral perfusion early in CPB. Which of the following is a potential long-term outcome of cerebral morbidity following cardiac surgery with CPB? A. Chronic kidney disease. B. Chronic pain syndrome. C. Long-term cognitive impairment. D. Myocardial infarction. Answer: C. Long-term cognitive impairment. Explanation: one of the potential long-term outcomes of cerebral morbidity following cardiac surgery with CPB is long-term cognitive impairment, such as dementia or persistent cognitive dysfunction. This is commonly associated with embolic events, ischemia, or hypoperfusion during surgery. Chronic kidney disease, chronic pain, and myocardial infarction are not typical long-term consequences of cerebral morbidity. Which of the following factors has been shown to significantly reduce the risk of cerebral embolism during cardiopulmonary bypass? A. Use of an arterial filter. B. High-dose anticoagulation. C. Prolonged cooling during CPB. D. Use of pulsatile perfusion. Answer: A. Use of an arterial filter. Explanation: the use of an arterial filter during cardiopulmonary bypass, CPB, is a key strategy in reducing the risk of cerebral embolism. These filters trap emboli and particulate matter that may otherwise travel to the brain. High-dose anticoagulation, prolonged cooling, and pulsatile perfusion are less directly related to embolism prevention. Which of the following is most likely to be observed in a patient who has experienced a significant embolic stroke during cardiac surgery? A. Immediate onset of motor weakness. B. Fluctuating levels of consciousness. C. Rapid recovery of neurological function. D. Absence of neurological symptoms. Answer: A. Immediate onset of motor weakness. Explanation: an embolic stroke often presents with sudden neurological deficits, such as motor weakness, hemiparesis or hemiplegia, typically on one side of the body. The stroke's onset is usually abrupt, and patients do not experience rapid recovery of neurological function. Fluctuating consciousness or absence of symptoms would not typically be associated with an embolic stroke. Which of the following factors increases the likelihood of neurological injury related to the duration of cardiopulmonary bypass, CPB? A. Increased use of heparin. B. Longer duration of aortic cross-clamping. C. Prolonged cooling to lower temperatures. D. Prolonged duration of CPB. Answer: D. Prolonged duration of CPB. Explanation: the duration of cardiopulmonary bypass, CPB, is directly related to the risk of neurological injury. Prolonged CPB increases the time the brain is exposed to risks like hypoperfusion, embolism, and other damaging factors, raising the chances of cerebral morbidity. While longer aortic cross-clamping and prolonged cooling may contribute to neurological risks, prolonged CPB itself remains a major contributor.